How is overflow incontinence different? Urinary symptoms. Imagine feeling like your bladder is always full, yet you can't quite empty it completely. That's the core of overflow incontinence, a type of urinary problem that's quite different from other forms. It happens when the bladder can't empty properly, causing urine to leak out gradually or constantly. This is different from stress incontinence, where leakage occurs when you cough or laugh, or urge incontinence, where a sudden rush makes you rush to the bathroom. Overflow incontinence is mainly caused by the bladder being overfilled because it cannot empty fully. This can happen if there's a blockage in the urinary tract, or if the bladder muscles are too weak to contract and push out urine. Common causes include enlarged prostate in men, which blocks urine flow, or nerve damage from conditions like diabetes or multiple sclerosis that interfere with bladder signals. In women, severe pelvic organ prolapse can kink the urethra, preventing complete emptying. People with overflow incontinence often notice they don't feel the usual urge to urinate. Instead, they might experience a constant dribble of urine or small leaks throughout the day. They may also feel like they haven't fully emptied their bladder after urinating, even if they go multiple times. Sometimes, the urine stream is weak or takes longer to start, and they might experience bladder spasms that cause involuntary leakage. This condition is more common in older adults, especially men with prostate issues, but it can affect anyone. Because the bladder becomes overfilled, pressure builds up, and urine leaks out without warning. Unlike urge incontinence, which is driven by an overactive bladder muscle, overflow incontinence happens because the bladder is too full and can't empty properly. Managing overflow incontinence involves treating the underlying cause. For example, if a blockage like an enlarged prostate is involved, medical or surgical options might be necessary. Sometimes, a catheter is used temporarily or long-term to help drain the bladder safely. Medications may also be prescribed to improve bladder muscle strength or relax the prostate. It's important to address this condition promptly to prevent complications like infections or damage to the bladder. From a bladder health perspective, overflow incontinence can sometimes be a sign of more serious issues like bladder outlet obstruction or even bladder cancer, especially if symptoms develop suddenly or worsen. If you notice symptoms like constant dribbling, difficulty urinating, or feeling like your bladder isn't emptying, it's essential to see a healthcare professional for proper diagnosis and personalized treatment. In summary, overflow incontinence is different because it involves the bladder being too full and leaking due to incomplete emptying. Its symptoms include constant dribbling and a feeling of incomplete bladder emptying, often linked to blockages or weak bladder muscles. Recognizing these signs helps ensure timely medical care to maintain bladder health and prevent further problems. Always consult a healthcare provider to find the best approach for your individual situation.